بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف الأنبياء والمرسلين سيدنا وحبيبنا ونبينا محمد وعلى آله وصحبه أجمعين. بسم الله نبدأ. Today I'll present you about thrombophilia. So first of all, you might have a question about thrombophilia. What is thrombophilia? Actually, thrombophilia is a pathological condition. So first of all, we have to define the thrombophilia. So an impaired balance between stimulating and inhibitory components of the homeostasis system. So as we all know, homeostasis is a normal or a normal mechanism in the blood circulating all over the body. So the first thing here, you have to know there is balance between stimulating components and stimulator components. So as we all know, the homeostasis system is composed of 4 components. They are, the first thing, vascular component, platelets components, coagulation components, and the last thing, which is fibrinolysis. So all of these 4 parts or 4 components, they have be kept in balance. So as we know, here the thrombophilia, it's a pathological condition. As I said in the first thing, the causes of thrombophilia, or we can classify the thrombophilia in 2 main parts or 2 main classification. The first thing, hereditary thrombophilia or type 1 thrombophilia, acquired thrombophilia or type 2 thrombophilia. So as I said, homeostasis, which is a balanced condition between stimulators and inhibitors of homeostasis components, which they are vascular component, platelets components, coagulation cascade components, last thing, fibrinolysis. They have be kept in balance. So let's talk about the pathogenesis. How does the thrombophilia occurs? I'll tell you a little bit of information about thrombophilia. Thrombophilia, it might be a fatal condition. Yes, it's a serious pathological condition. So you have to think about it. You have to take it seriously. So pathogenesis here. First thing, we have to talk about risk factors. Risk factor of thrombophilia, which is age. The increasing of age, it will give us an indication of, or one of the most important risk factor in thrombophilia. Also, immobilization, who's the people who they cannot move, or they cannot, they are paralyzed, they cannot move. All of these patients are concerning or of risk factor of thrombophilia. The other part, which is diabetes or other risk factor, diabetic patient, they may suffer from thrombophilia. Hereditary risk factor, we're gonna discuss that in the next slide. As you can see here, this slide is about coagulation cascade. Let's take extrinsic pathway. This is extrinsic pathway. So if there is vascular injury, the first thing which is gonna produce is tissue factor. This tissue factor, it will activate, or with combination of factor 7, so tissue factor with factor 7, they are gonna convert or activate factor 9 to activated factor 9, and they are gonna activate factor 10 to activated factor 10. So here, sorry, I'm looking for the mouse. Sorry. Hey. Activated factor 10 it will convert prothrombin to thrombin. So if we reach here on thrombin, thrombin will convert fibrinogen to fibrin. So this is the end of coagulation cascade. We are gonna concerning about factor 10 and factor 5 here. So let's go to other slide, which is the pathogenesis. So the inhibition of factor 5 by protein C and protein S. Let's have a look here. This is factor 5. Here on factor 10, when it's activated, it will convert prothrombin to thrombin. When thrombin is produced, it will convert factor 5 to activated factor 5. And this helps us with factor or activated factor 10 with activated factor 5, it will convert prothrombin to thrombin. So thrombin is gonna activate itself in indirect way. So here it's too important to get the activation of factor 5 through thrombin. Also, factor 5 is inhibited with with protein C, which is anticoagulant factor. Protein C, it will inactivate factor 5. If there is a mutation on the factor 5, it will make a resistance on the protein C, and the protein C cannot inhibit factor 5. So the inability to inactivate factor 5, it will produce more prothrombin, which will be converted to thrombin, and a lot of thrombin, it will produce what? Which will produce a thrombosis. So this is the first pathway on the pathogenesis. Let's talk about another pathway or other way of pathogenesis, which is the inhibition of activated factor 10 and thrombin with antithrombin 3. Let's have a look here. This is activated factor 10 and thrombin. It's inhibited with many inhibitory coagulators or anticoagulant factors. So which is the most important one which will inactivate factor 10 is antithrombin 3. Antithrombin 3 will inactivate factor 10. So if there is a mutation on factor 10 or on thrombin, it will make a resistance against antithrombin 3, which will the inability to inactivate factor 10 or prothrombin, it will produce a lot of thrombin, and that gives us a great chance for thrombosis. Have a look here. The inhibition of activated factor 10 and thrombin with antithrombin 3. If there is a mutation in prothrombin or activated factor 10, it will make a resistance against antithrombin 3 and give us a great chance of increasing of thrombosis. So the diagnosis, to diagnose a patient with thrombophilia, we're gonna make specific laboratory tests for antithrombin 3, protein C, and protein S. We'll find all of these three components, which they are anticoagulants. They will be decreased. So the management and treatment of thrombophilia. We'll give a patient a low molecular weight of heparin, also heparin, warfarin, vitamin K antagonist. As we all know, heparin it helps the homeostasis. in the vessels. Also, vitamin K antagonist, they will work against coagulation cascade. It will help us on the treatment. Um, we are not concerning about clinical parts, but just to have an idea. Prognosis of thrombophilia. The prognosis for patients with hypercoagulation disease such as thrombophilia, depending on how serious the clots are. If the clotting is so much, it will make a serious thrombophilia. If it's a little bit, so let's have a look. If thrombosis is unnoticed or untreated, it could lead to pulmonary embolism. Okay? A potentially fatal condition in which blood clot obstruct the lung airway. So if we untreated the thrombophilia, it might goes to pulmonary embolism, which is a very serious fatal condition in the hospital. So common conditions associated with thrombophilia, we'll find deep vein thrombosis, which is usually on the lower limb due to the specific gravity. Also, we'll find pulmonary embolism, venous thrombolism. So I hope you've got useful from this presentation, and there is another link and other slides. It contains a lot of information. You can get useful from them, and good luck. Presented by Abdurrahman Al-Sharif. Thank you so much.